Hi, everyone, and welcome to today's webinar, Evidence Building for Cash and Markets for WASH and Emergencies. My name is Nicole Weber, and I'm Senior Specialist for Capacity Strengthening and Learning for the ProWASH Award. And we're organizing this webinar today jointly with the Global WASH Cluster and CALP. Next. Before we get started with the webinar, we would like to encourage you to download the app or open a tab on Google, Chrome, Edge, or Mozilla Firefox if you would like to use interpretation today. We have interpretation from English to French, Spanish, and Arabic that is available. And my colleague has put in the chat box the link where you can access the interpretation if you haven't already downloaded the app. Once you are in the app or you are on the website, you are able to access one of the three languages by selecting in the drop-down box, and then you can connect to that language throughout the whole webinar. You will still need to have Zoom open in another window. Next slide. And you will need to make sure that you mute Zoom so that you can hear your other language in the app, but still be able to follow along on the slides and to be able to see all of the content. During this time, you can also use the chat and the Q&A box to share with the panelists your ideas or your questions, and then you'll just be using the other website for the translation into Arabic, Spanish, or French. Next slide. So I'll turn it now over to Lynn, but if you have any challenges with interpretation, please just drop that into the chat box to all panelists, and I can help troubleshoot as we get started on the webinar. So thank you, and I'm looking forward to the webinar and handing it over to Lynn.
Thanks, Nicole. Good morning, good afternoon, and good evening, everyone. My name is Lynn Yoshikawa. I'm with the Cash Learning Partnership as the Americas Regional Representative. And as a network of over 90 members, we work to enable collaboration between organizations to increase the scale and quality of cash and voucher assistance. We're pleased to co-facilitate today's events, which is targeted to WASH practitioners, cash and voucher specialists, donors, and other humanitarian response actors. If we could go to the next slide. I'm sorry, if we can go back, actually. So please, today, share your questions in the Q&A box at the bottom toolbar in Zoom, and we will go through them. And you can also upvote specific questions, and that will help us prioritize questions for the Q&A session, because we probably won't be able to get to all of them today. So for today's agenda, we'll start with opening remarks from Ms. Monica Ramos, the Global WASH Cluster Coordinator. We will then turn to a presentation of the evidence review findings from Olivia Collins, Cash and Voucher Assistance Consultant, and Jean-Christophe Balbiche, the Global WASH Cluster's Capacity Building Specialist. And then we'll end with a Q&A session. So without further ado, I will hand it over to Monica.
Hi, Lynn. Thank you so much, and good morning, good afternoon to all of the participants. A big thanks to all of the co-conveners of the event. It's been very exciting to work with all of you. I know in previous webinars, and we're really happy to be here today to present the findings of the evidence building report series that we have conducted looking at cash and markets for WASH and emergencies. Next slide, please. So today, just to give a little bit of a highlight of what we're in for in terms of the presentation and discussion. As many of you may know, over the recent years, the humanitarian aid organizations have been increasingly using market-based programming to deliver WASH and emergencies. This includes a variety of market-based modalities, which can be that of distribution of cash and vouchers, which also helps to enable recipients, households to access WASH goods, and also to support WASH markets to deliver them at humanitarian standards. I think one of the interesting points here is really how we've been able to adapt a lot of the ongoing work that some of our development counterparts have been doing with really working with wash systems or wash markets in countries, and really how do we adapt this to fragile or insecure context where many of us work. So it's really about how do we take markets-based programming that has been happening in the wash sector and actually bring that into the lens of the work that we all do in emergencies and humanitarian settings. So we see this having quite a few advantages in terms of being able to contribute to economic recovery. It also really helps to address the affected population's basic needs in a more efficient and effective way. And it also really helps give a level of independence for those that are receiving this modality. So we know that, we have been using this over several years, but we recognize that some of the evidence may not actually be there in terms of really understanding how has this resulted in a positive effect on WASH outcomes. So this is really what we wanted to focus on today in terms of the systematic review that was conducted by the Global WASH Cluster, where we really examined the different case studies and practices currently ongoing in the humanitarian setting by WASH actors, where they've actually used market and cash modalities to deliver essential WASH services and goods. And we also really wanted to look at the effectiveness of market-based programming, as well as how effective is that to achieve humanitarian WASH outcomes. So in terms of availability, access, quality, and also the actual use of the goods and services attained, particularly in emergency context. We also recognize that it's really important to look at the scale up. So we'll also be discussing that today as well. How do we actually take this to scale? And we'll also be really looking at speaking with all of you around current practices, maybe emerging evidence that all of you are working on, research gaps, as well as recommendations for next steps. So thanks again for all of you joining us today. We know how busy everyone is at the end of the year, and I'll be handing over to Olivia Collins and Jean-Christophe Barbiche for the main content of the presentation. Thank you.
Thanks, Monica. So my name is Olivia Collins. I'm Cash and Voucher Assistance Consultant, and I worked on this study with Jean-Christophe Barbiche. So this slide gives an overview of all of the reports that we produced in this study. You can see we produced 4 reports which look at the practices of market-based programming, so both cash and voucher assistance and market support in the WASH sector. So we have a practice report for each of the WASH subsectors, one for water, one for sanitation, one for hygiene, and one practice report which looks specifically at the use of multi-purpose cash for WASH outcomes. There's also the evidence mapping report, which looks specifically at the evidence, the documentation that we have of the effect of market-based programming on WASH outcomes. And finally, the summary report, which presents the findings from all of the 5 other reports. So after this webinar, I encourage you to explore the reports. When you receive the presentation, you can click on the icons on the right to access the reports. Next. So I'll start by presenting briefly the first part of the methodology that we used. And we started off with defining our key terms and the scope of this research. So Jean-Christophe, if you can present the whole diagram, perfect. Okay, so we looked at practices from throughout the humanitarian program cycle, from assessments to response analysis to implementation and monitoring. And there are a couple of key terms I want to pick out here. So cash and voucher assistance, CVA, when cash or vouchers are provided directly to households or individuals. For the WASH sector, when these vouchers or cash are used to help households access goods and services which are available on the local market. Market support, supporting critical markets which provide those WASH goods and services, whether supporting private, public or community actors, or helping to restore infrastructure or supporting services. So more on the supply side, whereas cash and voucher assistance is a demand side intervention. And both cash and voucher assistance and market support are market-based modalities. Now, market-based modalities are one of the many approaches or tools that can be used in the WASH sector to meet WASH needs, as you know, along with direct service delivery, technical support, behaviour change, advocacy. And in this report, we refer to complementary programming when a number of different approaches are used together. So I guess the key terms to remember from this slide are cash and voucher assistance, market support, and this idea of complementary programming, of using market-based modalities and other approaches, combining them to achieve WASH objectives. Next. So this slide gives an overview of the documentation that we reviewed for this study. We started off with over 300 documents from online sources, from databases, which we read, screened, identified 200 documents which were relevant for the study. We analysed these in detail and classified them according to the practices that they presented, whether for the water, sanitation, hygiene, subsectors, or with regards to multipurpose cash. And this formed the basis, with the key informant interviews, this formed the basis for the practice reports. Then from this documentation, we identified a subset of documents, 51 documents, which we considered to be evidence. And we use a broad definition for evidence here. So monitoring reports, evaluations, research, any documentation which shows the effect of using market-based approaches on WASH outcomes. And so this subset of documents was the basis for the evidence mapping report. Thank you. I hand over to Jean-Christophe.
Thanks, Olivia. So my name is Jean-Christophe Barbiche, and I've been working together with Olivia as a WASH specialist on this study, which started in almost 1 year ago in January. So the next point in terms of methodology that I wanted to present was the causal framework, or theory of change that we have worked on at the very beginning in order to identify how the desired change in terms of WASH outcome will be reached through market or market-based or non-market-based programming. So you have here the presentation of what we did in terms of causal framework. So you have the implementation modalities in the bottom, whether they are market-based or non-market-based. So you can find again the cash and voucher here. You can find the behavior change, obviously, microfinance, all what is related to market support the private WASH market actors, etc. And these modalities, whether they are used as a single modality or combined together, they will lead to reaching some outcomes and some impacts. So this list of 5 outcomes, I think, was one of the key aspects of our work. We got inspiration from a list of outcomes that was defined in the basic needs analysis, which is a methodology that was developed by a consortium led by Save the Children in 2018. And those 5 outcomes are availability. So whether this outcome is related to market, basically, to what the market can offer. Are the goods available in the market? Are they affordable? Is the market competitive, integrated, etc. Then you have the access, which is whether the people have managed to access, so to buy or to get for free sometimes the goods and services that we would like them to access. Then you have the quality indicators, which relates to the fact that the goods and services are of good quality, obviously, but also the quality of the delivery. So whether the people are satisfied, whether the delivery respects basic gender, accountability mechanism, etc. the awareness of whether people are aware of where to find those goods and services and how to use them. And finally, the use, which is maybe the most important one for WASH, are the people, what are the use the people are making of the goods and services that they have purchased, because in many instances, people can access to those goods and services, but not use them adequately. So that's where all the behavior change communication enters into practice. And finally, you have we have defined two impacts. So one that may be really common to WASH project, which is related to WASH-related morbidity and mortality. But then we have also added this one, which is related to whether the market are more resilient to shock, which eventually should lead to the other impacts related to health. So once we have defined this, those outcomes and impact and practices, so we have, as Olivia mentioned, wrote the 3 reports on practices. In those reports, I mean, there are 4, yeah, because one report is specific to MPC, and in those reports, we have for each sector, so water, in general, we have worked separately for each sector, because if you talk about water market or sanitation related market, these are very, very different things. So we felt the need to really separate the things, although the WASH programs often they are integrated. But for each of the sector, we have analyzed each modality. So let's say, for instance, support to private sector, private actors, and we have defined, considering what the documents we have read and reviewed, we have defined the role and benefits, so what the agency was supposed to achieve with this modality. The enabling factors, so what are the conditions in which they were implemented. For instance, many of those modalities that we reviewed were implemented in recovery, but not in first phase response. And then finally, what are the risks and limitation of this type of approach? So you can, when you download the reports, you will find a table for each modality, for each sector, that is giving you all this information. And finally, we have tried to describe, without going too much into detail, because obviously we reviewed hundreds of documents, but we have tried to summarize. When you speak about microfinance for sanitation, when you speak about supported hygiene market policies, for instance, what we observed as modality. And this is for the practice, but when you talk about then the evidence, there was only a few. I think less than a fourth of the documents that were considered as evidence, as providing evidence, meaning that when the outcome or the impact were somehow monitored. Or we had information on the effect of the modality on those outcomes. And obviously not all the documents provided this type of information. And so what we have done to start was to analyze the effect. So of each group of modalities, so whether they were support CV, like multi-sector voucher, or multi-purpose cash, each of those example of practices, have they managed to successfully achieve one of the outcome or one of the impact. So we have classified all the documents like that. And finally, we have calculated the strength of evidence for each group of modality based on the number of evidence we collected. So the more evidence, obviously, the stronger was the evidence base. Also, we considered in calculating this evidence score the number of rigorous evidence, because some documents were just lesson learned or field reports. Some other were reports from operational research with a very rigorous methodology using control groups, etc. So obviously, the more rigorous evidence a group of modality had, the better was the evidence. And finally, we considered also the direction of effect, because even though a group of modality, like for example, WASH specific voucher, had not a lot of rigorous evidence, if they were pointing in the same, all of them in the same direction, then the evidence base was somehow stronger. So we have talked about the methodology, and you have in the reports, especially in the evidence one, and the annexes, more detail about the methodological approach that we have followed. But here we wanted also to focus on the findings for the webinar, because that's obviously something that everybody is interested in. And again, we have divided the findings into the two group of modalities, which are basically market support, so supporting the demand, supporting the offer, supporting the market actors, and then on one side, and then the other one supporting the demand through cash and voucher assistance. So in terms of supporting the market, we have classified all the example of practices that we have reviewed into those 9 modalities. So support to public infrastructures. Often they were, if you talk about water system, for instance, they were public water infrastructure networked. Often it was done in urban context, this modality. You had also the work that was done with private actors. So whether they were water actor like water trucking companies, or hygiene actors, meaning often the hygiene vendors or the hygiene producer, or sanitation actors, which can be the person who are dislodging manually or mechanically the sludge of the latrine. We also noticed reviewed some interesting practices related to the use and the support of community actors in emergency, because those type of actors, so water users association, water committees, village committees, school committees, all those are actually part of the wash market somehow, because they provide the exchange article or services. So as per the definition of CALP, they are part of the market. And we saw some really interesting example of using a water user association, for example, to provide them with fuel voucher in the northern Kenya during the drought. So they will provide, they will pump and they will provide water for free to the population. We reviewed quite a lot of social marketing intervention. Also, those interventions tend to occur in more development context, and we wanted to focus as much as possible on emergency, but somehow they have the potential to, I mean, first of all, they could be implemented in protracted long-term emergencies, such as in DRC or in the north of Chad. But also they have the potential to really improve the resilience of the population and the market actors to disaster. So we reviewed some of those interventions in sanitation and in hygiene, mostly like hand washing device, for instance. Improve market policies was done also, especially for water. I mean, how to, for instance, to improve the water trucking. I mean, the place where the companies trucking water are taking their water. How to make those places official with a cost recovering for the public institution that is managing those boreholes. Microfinance was used a lot in sanitation. We saw some, we reviewed, we didn't see a lot for water. I mean, there was some organization like water.org who are actually providing some microfinance to vulnerable population to improve their water system in their household, for instance. But this was not done in emergency, although this can have, I think, quite a good potential in terms of preparedness and resilience building. Local labor skills was used. I mean, there was some interesting cash for work intervention that we reviewed. Also, we didn't consider cash for work as a real market-based programming. Often it was very multi-sectorial, although the work that was provided was related to water or to sanitation, but yeah, we didn't really consider it as very interesting in terms of developing the market, unless it was done with to develop the skills. Because cash for work is often using unskilled labor, but in some case, in Iraq, for instance, through vocational training, you could see that that it was used to develop the skills of the plumbers, of mason, etc. And finally, the local procurement, which is basically to favor and to prioritize local actors in terms of procurement. So we found a few enabling factors for implementing a market support intervention. For instance, you need to have pre-existing WASH market. So it's very complicated to develop a new market in emergency, even a protracted one. It may take years. So somehow you need a pre-existing market functioning before the emergency, which is actually an issue for sanitation, because often, especially in rural area, there is no market for sanitation. So very complicated to work in sanitation in terms of market support in emergency. Most of the intervention we reviewed were done in preparedness or recovery phase, but very few in first phase emergency response. So those two phases, preparedness, recovery, are kind of enabling phase for market-based programming. Market support was also used a lot as a complementary to cash and voucher assistance, but in very few cases as a standalone activity, which is quite normal, because in emergency you expect people to have lost their income. So somehow to stimulate the demand, you will need some form of cash or voucher assistance as well. Many modalities like improved market policies were only used in stable context and with long project duration. In terms of local procurement, you need flexible procurement rules as well, because very quickly you reach the limit where you have to open the tender to international, national or international actors. So to favor local actors, you need some form of waiver in terms of logistic and procurement rule. Coordination with other sector. Many of the WASH market are actually multi-sectorial. If you take sanitation, for instance, it's really integrated in the construction market. Hygiene, there's a lot of link with shelter as well. So somehow the collaboration with other sector is key. Like the hygiene items, for instance, they are not sold by hygiene vendor. They are sold by grocery shops which also sell some food, etc. So if you want to support those actors, you also need to work with other sectors. And finally, we saw that those modalities were often used as an exit strategy. So, for example, long-term refugee camp, in which we try to find some ways to disengage, and then we start to look at market actors and solution to make the intervention. I mean, the beneficiary and the market actors working autonomously without external help. And market support was less adapted when the markets are unregulated. If you take the water market, for instance, it's thriving in many places, in Mogadishu, in Haiti. But if you want this market to deliver humanitarian standards assistance, then somehow you need some form of regulation from the government, which is often lacking. So I'm going to pass now the speech to Olivia, who will tell you about the practice related to cash and voucher.
Thank you, Jean-Christophe. So in terms of the practices that we reviewed for cash and voucher assistance, next. Thanks. So we categorized them according to 4 modalities: WASH-specific vouchers, multi-sector vouchers, WASH-specific cash, and multi-purpose cash. And the bulk of the practices that we reviewed fell under 2 of these modalities: WASH-specific vouchers and multi-purpose cash, the majority of the practices. So first of all, WASH-specific vouchers. So when vouchers are delivered to households and are designed to be used for WASH goods and services, we saw this being used a lot for water, hygiene items, also sanitation, for latrine construction. Vouchers were used to enable households to buy materials or to pay for labor to build the latrines. Sometimes vouchers were used for latrine desludging, for example, in Lebanon. There are examples of this practice, and sometimes used for the purchase of household water treatments, for example, in Zimbabwe and Haiti. But I think there's a tendency in the WASH sector to use vouchers because there's some quality control that can be maintained by WASH colleagues. There's direct contact with the service provider, with the water truckers, for example. So there's a level of control which is maintained. So I think that's why there's a tendency for it to be used in the WASH sector. Multi-purpose cash, very different, but we saw a large number of practices in which WASH-related costs were integrated into minimum expenditure baskets, and multi-purpose cash was intended to meet WASH-related needs. Monitoring showed that multi-purpose cash was used by households to purchase water and hygiene items, particularly adapted for water and hygiene. So for regular, predictable costs that are the same every month, because multi-purpose cash is often delivered monthly, and multi-purpose cash is adapted to those regular, predictable costs. Used a lot in the MENA region, particularly when water is included in water utility bills. Sometimes sanitation costs are also included in utility bills where households, apartments are connected to sanitation networks. Multi-purpose cash is less adapted for one-off irregular costs like latrine construction, for example. Now, I'll come back to the other two modalities for which there were less practices, multi-sector vouchers. So when vouchers could be exchanged not only for WASH goods and services, but also for goods and services from other sectors. We saw examples of this in DRC, where there's been extensive use of voucher fares, and soap and other hygiene items were available in those voucher fares, but also lots of other kinds of items. And it can make sense to have multi-sector vouchers because a voucher delivery system just for WASH can be costly, time-consuming to set up. So sometimes WASH colleagues come together with other sectors to provide these multi-sector vouchers. WASH-specific cash refers specifically to, well, the examples that we saw mostly related to the conditional cash for latrine construction. So in contexts of refugee camps in Kenya, in South Sudan, we saw examples of cash being delivered in installments, conditional on households contributing to the latrine construction. Thanks. Next, Jean-Christophe. So some enabling factors. Obviously, CVA cash and voucher assistance is enabled when financial access is the main barrier, because it provides the financial means for people to purchase what's already available on the local market. When there's already demand for WASH goods and services, people are likely to use their cash to purchase WASH goods and services. They have good knowledge, attitudes and practices. Works well, cash and voucher assistance works well when there are joint or existing delivery mechanisms, and that's the case for multi-purpose cash, where WASH-related costs are together with the costs of other basic needs, and a single cash transfer is delivered to cover all of those needs. And as I mentioned, multi-purpose cash is well adapted for regular and predictable costs. Cash and voucher assistance is less adapted when there are supply side barriers. It makes sense. Cash and voucher assistance is a demand side intervention. So for example, we saw in Lebanon that the delivery of multi-purpose cash enabled households to have better access to drinking water because they bought the drinking water in local shops in 5-litre bottles. However, it didn't have an effect on domestic use water because the domestic use water was provided by the local municipalities, and providing cash cannot change those supply side barriers. It needs to be done in complementarity with other interventions. Similarly, cash and voucher assistance is less adapted when behaviour change is required, and less adapted, as I mentioned, to one-off or high costs like latrine construction or improving water supply infrastructure. Those more expensive costs may be difficult for households to use multi-purpose cash assistance to pay for those big lump sums. Thank you. I hand back to Jean-Christophe.
Thank you, Olivia. So these were the summary of the practices. Yeah, but for the documents, for those practices, we also included the monitoring of the effect. We managed to produce evidence map. So we have 5 of them, one for each sector, including household water treatment, because household water treatment was, we did a specific one because yeah, it's not really water, it cannot be included in the water, cannot be included in the hygiene, so we had a separate one. And those evidence maps, I mean, we discussed a lot about the best way to represent visually the evidence that we found, because I mean there was a lot of, yeah, obviously 3 different sectors, a lot of different modalities, a lot of different indicators. You know, availability is not at all the same on that use, so we had to really take all those parameters into account. And we produced this evidence map. So this is an example for the water. So you can find the other maps in the reports, but I'm going to comment this one to you. So here in vertical, you have the strength of evidence. So so you go from negligible evidence to high level of evidence, and in horizontal, you have the positive effect. So whether a lot of the evidence that we have reviewed were producing a positive effect on WASH outcomes. In orange, you have the cash and voucher interventions, and in blue you have the market support intervention. So if you take, for example, and then you have the outcome, so access, availability, access, quality, etc. Health here. So if you take, for example, this bubble here, there was 19 intervention that we reviewed. So MVP for water intervention that we reviewed that measured the access of water to the beneficiaries, and because it's around here, there was a lot of those 19s that had a positive effect on the access, and the strength of evidence is medium, so it's quite high as compared to others. So there was a lot of evidence that CVA for water is producing good effects on access indicators. It doesn't mean necessarily that the water was of good quality or the water was adequately used in the household, but at least that they have access to it, so which is already an achievement. And then you have others, like for example, the use. So whether the market support intervention, the 4 market support intervention that we reviewed had a good effect on use. So few of them had a positive effect, and the strength of evidence was very low. So you can find the other maps in the reports. Those maps led to 2 allowed us to define 2 things. The first one was the emerging evidence, and the second one was the gap. So in terms of emerging evidence, we have made this table where you can see the group of modality and the indicators where we have some evidence. So I was mentioning before the CVA modalities used for water on water access, which we have some relatively good evidence of positive effect. For sanitation also, we had good effect on access, mainly through a voucher. There was quite a lot of intervention, you know, mixing voucher and conditional cash for building latrine in camps, which also in some case measure the quality. You know, the latrine constructed were of good quality. So we have some information about that. Same thing for hygiene and access. We had very few measurement of the use of those cash and voucher used for hygiene. But we had some measurement that those cash and voucher assistance had some positive effect on the market, on the availability. So the vendors were satisfied, they made some profit, they in some case extended the range of the product that they were proposing in Haiti, for instance. And same thing for the market support. So market support intervention for supporting the water market. Obviously, because it's the idea. So produce some positive effect on the market indicators. If you take, for instance, all the work that were done in the MENA region with as a preparedness often with the water supply infrastructure by UNICEF, IFRC, Oxfam, preparing those infrastructure, water treatment plants, potable water production, etc., preparing them for the conflict with a stock of spare parts, training their staff, etc. This produced a good positive effect on the water supply during the emergency, and we have some evidence that it did actually produce positive effect on the access. For sanitation, we have almost nothing because the sanitation market in emergency was not something that the humanitarian actors wanted to work with, either because it was inexistent or very risky to set up a new market in emergency. But for hygiene, we have some good evidence that supporting the hygiene market increased the availability, the access, the quality. The use and health indicators are somehow, they were less measured, and there is no emerging evidence on that because the strength of evidence was too low. So this was the emergency, the emerging evidence. We had quite a lot of gap as well that we identified. For example, the added value of MVP, because in many instances we managed to observe a positive effect of MVP modality on wash, on water, etc. But in very few instances we could compare this effect to a non-market-based modality. So this is something that needs to be strengthened in the future. The monitoring of quality and use indicator was somehow lacking. There was a lot of monitoring of access. Where did people access, the soap, the latrines material, etc., with their voucher, with their cash, but not really on the use they made out of it, and which quality was those items. The level of readiness of wash teams. I mean, most organizations now they have quite a good level of preparedness in terms of cash and voucher assistance, but somehow this only concerned some sectors of the agency, but the wash team in themselves they were not so ready to implement those modalities. They did, but in recovery phase. In the first phase response, very few did. To support the wash market in preparedness, there was some attempts to do it, and Oxfam, for instance, have some really interesting program in Zimbabwe, in Indonesia, to work in preparedness. But somehow, it was not very well documented. Either it was not very well documented, either it was not happening a lot. We didn't review a lot of those interventions. First phase response, it's I already said that it was a gap in terms of CV and market support. WASH complementary programming. So we somehow reviewed intervention where several modalities were used. For instance, behavior change and voucher. But it was difficult. The documents often focus on the CVA part. So describing the vendors, the amount of cash, etc. But how the rest was done, in terms of behavior change, sometimes in terms of direct service delivery of some items like menstrual hygiene management items that were unlikely to be purchased by beneficiary. How this happened, because it did happen in many cases, but sometimes by other agencies. So the coordination of all those modalities that we can call complementary programming was not very well documented. The coordinated use of market-based programming across sectors is also something that is extremely complicated at the level of assessment, the markets, who is doing the construction market assessment, and also at the level of response analysis by choosing which modality for each sector, knowing that those modalities and those sectors, they are interconnected. So this process is extremely challenging. And finally, we didn't find a lot of evidence that those modalities, they actually improve wash market resilience. We struggled to define what was wash market resilience actually. So we didn't make any maps, evidence map related to that. And to finish, I will present the way forward. So the conclusion of the studies and the recommendations. So we recommended some operational research to be carried out to complement the evidence that we have. The first one was actually to be able to compare market-based and non-market-based. So as all operational research, this is extremely challenging to do in emergency context, because people are moving here and there, and that there is also some ethical aspect of implementing studies in such context. But still, it's a gap. Yeah, we need to know. We need to prove that market-based programming are actually better in achieving outcomes such as market resilience than other programming. There was also something. Priority research area identified in terms of preparedness. So how the preparedness activities done by the actors are actually leading to quicker and faster use of market-based programming in emergency, and do they help to produce better wash outcomes as well. Complementary programming was also a gap, and we hope that research could fill this gap, especially for MPC. So multipurpose cache, is multipurpose cache used without behavior change, for instance, for wash, which is the case in many instances. The cache is distributed, but there is no specific behavior change communication made on wash to the beneficiaries. Maybe there is some others for nutrition or whatever, but for wash, we haven't found a lot. And does this produce the same outcome than multipurpose cache with behavior change communication? That's an example of research that can be conducted. And finally, the fourth aspect was to study the link between the development and humanitarian programming, and what is how market-based programming can achieve a better link between the two sectors, development and humanitarian. And the last slide, to finish the recommendation that we made to the global wash cluster. So first of all, there was the need to generate new evidence. So operational research, that's what I mentioned, but also knowledge management. So we stopped reviewing documents in July, I think, but since July, we still saw a lot of documents coming and interesting reports, to be that will strengthen the evidence base. So we need to find a way to capture those new evidence and to add them to the database to slowly build the evidence base for market-based programming. In terms of capacity, so there was a specific issue on monitoring, because there is actually a lot of market-based programming implemented, which can lead to better wash outcome. Multipurpose cache, for instance, even if they are not complemented with behavior change communication, can give some positive effect on wash outcome. But this is the capturing of those indicators is really complex, because you sometimes often even need some specific wash staff to monitor, in the home of the beneficiary. Are they using soap? Are they using a latrine? Which type of latrines, etc. So there was a lot of capacity building to be done in terms of monitoring, and especially for the quality and use indicators. There is a need to scale up the trainings. The Global Wash Cluster has set up a training strategy for market-based programming for WASH. We did already 3 face-to-face trainings in Africa and Asia. We are doing 6 currently online training on market-based programming in Cameroon, in the Caribbean region, in Somalia. Next one will be Yemen. But still, yeah, we need a strategy to increase and to scale up those training. And finally, boosting the inclusion of market-sensitive approach in WASH operational response through preparedness, both at institutional level, so how the organization will be better prepared to implement market support, better prepared and equipped, have more adapted staff to implement market support in emergency and CVA, and but also programmatic in terms of implementing market assessment before the emergency, and working with market actors in preparedness to improve their resilience, for instance. And finally, the whole aspect, the coordination, which is still a gap in terms of cash and voucher assistance, but also market support. Sorry, how can we coordinate all those approach across the sectors in emergency response through the cluster system, or other coordination mechanisms such as a consortium, for instance. So we reached the end of the presentation. So we would like to thank, first of all the members of the TWIG, the technical working group of the Global WASH Cluster, who have helped a lot in commenting, in improving the 6 reports that we have produced. We would like also to thank CALP, because they're actually part of the TWIG, they are members of the TWIG, and ProWASH for their support in delivering this webinar, which is actually just one of the many webinars that they have facilitated this year on market-based programming. You will receive the presentation, so you will access to all the documents through the links here. There was some that Olivia also presented before. And I would like to thank you a lot for your participation, and good luck for implementing more practices in terms of market-based programming for WASH in emergency, because we need them. Thanks a lot. We will have now a question and answer session, so please stay connected and ask your question. Yeah.
Thank you, Jean-Christophe and Global WASH Cluster colleagues. We had a lot of questions coming through, and I'll just pull out, there were a couple related to minimum expenditure baskets. So a question would be is how to make minimum expenditure baskets more WASH sensitive, particularly given the various coordination challenges that we see in the cash side, as well as across the overall intersectoral response. Over to you.
Olivia, do you want to answer to that one?
Yeah, I can try and answer. So in the minimum expenditure baskets that we reviewed, I think we reviewed 18 from different contexts. We did see WASH-related costs included in minimum expenditure baskets. And we saw in monitoring that multipurpose cash was used to purchase WASH goods and services. Maybe I can be a bit controversial and say that the minimum expenditure basket is important for getting all of the different sector colleagues involved, but the value of the cash transfer is really important. You know, if you have a minimum expenditure basket, even if WASH costs are included, but the actual cash transfer afterwards is so small that it doesn't meet basic needs, households have to prioritize. So we saw in some instances that hygiene items, I think it was in Lebanon again, that there was some evidence of hygiene items being one of the items that households will choose not to buy because they have to prioritize water, food, other basic needs. So, I mean, minimum expenditure basket is important, but the actual value of the cash assistance is really important, and of course the targeting. Thanks. I don't know, Jean-Christophe, if you want to add anything else, or
no, we can take the next questions. Yeah. Thanks, Olivia.
Great. So we have a couple of questions on the study. When the desktop research was conducted, did the research show an emphasis on countries and/or regions where MVP for WASH has occurred? And then a second one, did you see any negative effects of MVP in cash and voucher assistance interventions?
So in terms of, I mean, we collected basically all the documents we could from online databases, from the cluster partners, university databases as well. You know, we had quite a lot of interesting studies. Obviously, there was a lot of documents that came from the Middle East region and East African region, because those two regions are really advanced in terms of using cash and voucher. But in terms of market support, after we had a lot of evidence practices in Asia, for instance, Bangladesh, Cambodia, or even in Africa in more development-oriented contexts such as Ghana. And the second one, so
any negative effects identified?
I don't remember. We saw some negative effects. We saw significant amount of neutral effect, which when you talk about humanitarian interventions, may be considered as a negative effect. So it means that we haven't achieved, you know, the desired result. But yeah, there was no. We didn't really find any documents where, you know, indicators had worsened because of the intervention. We saw obviously a few documents showing that the in-kind delivery have worsened market indicators because vendors complaining that you know, they cannot sell their goods anymore, and then the beneficiaries selling those items at a lower price to get food, etc. We saw a few, not a lot, but I think in Lebanon it was documented. But negative effect of market-based programming, yeah, Olivia? No.
No, I mean, perhaps just to add, a lot of the documentation we reviewed was project-related documentation. There's a lack of robust evidence that may be, so there may be a tendency to measure positive effects or neutral effects, and less likelihood to even to look at negative effects. But no, we didn't see evidence of negative effects.
It doesn't mean because we didn't see them that they don't exist, and we have identified some limitations, risk, you know, in many instances, like delay in the response, for instance. You know, the whole market assessment and the response analysis, you know, integrating the market-based modality, it's something that is complex and can take some time, and may, you know, delay the response. But it was an assumption. We have not seen any document regarding that.
Great. And now we have a few more minutes left in the hour. Maybe a final question to the panelists. What's your recommended key takeaway to participants, and what would you like participants to do next to put these findings into practice?
Maybe the best person to answer to that will be the Monica Ramos, the Global Watch Cluster coordinator. Monica, do you want to take this one?
Sure. Thanks, JC. I can quickly jump in. So yeah, indeed, we've outlined quite a few recommendations. So I think one of the main ones is really looking at how we can integrate this into our programming. So across, whether that be in research, I know that there's a key focus on operational research, also looking a little bit more at capacity development. So there are quite a few initiatives going on, and there's quite a support out there to build partners' capacity to systematically monitor indicators and also implement market-based modalities. But again, we need to take a targeted approach to that. So I think it'd be very important that either in countries you're working in or countries that maybe you're supporting, we really start to scope out how maybe we could be doing this better, or maybe what are the avenues for market-based programming in cash. So I do think that that's something we're quite interested in terms of the countries with existing coordination platforms to see how we can help support that and make sure that we're able to take this to scale. And then of course, we want this to really become part of the way that we do business. So really, what is the inclusion around market sensitive approaches, particularly looking for the use of them in complementary programming. So I think kind of some standard recommendations there, but I think it's really maybe a question back to everyone who's on the call today. How do you see market-based programming and cash going into the work streams that you are involved with? So I think both organizations, donor agencies, and that of coordination, we all have a role to play in this. So I think it is good to continue this conversation and see how we're able to pull this together and see an increase in the use of this modality through the different responses that we support. Over. Thank you.
Great. Thank you so much, Monica. Thank you to Jean-Christophe and Olivia for your presentations today, and thanks to Lynn for co-moderating. We'll be sending out a recording of today's webinar along with the presentation. We'll also share a few resources that might help you. I saw several questions come in around the how-to market-based programming, and the Global WASH Cluster has a technical guide on how to do market-based programming for WASH, and there's a lot of different resources in there that you'll find really helpful. We'll also share a recording of the webinar we did this spring, which was a 75-minute introduction to what is market-based programming for WASH, which might help to answer some of those questions. And we'll also be sharing the reports. So thanks everyone for your participation today, and thank you so much for all your questions. It was great to have your feedback.